Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to discuss some of the things that you can expect as you attempt to return to work following rotator cuff repair. So let's talk a little bit about work. Many of my patients with rotator cuff tears are heavy laborers, farmers, or construction workers. Obviously, it is vitally important to have a fully functioning rotator cuff in order to perform these heavy labor jobs. You can expect after a rotator cuff tear that you are going to have significant restrictions on your arm in terms of lifting. Although I do allow patients to go back to work, we do so on a restricted basis. Initially, your work restrictions may say no use of the arm. We then will progressively allow you to do more activities based on your progress with rehab and how severe your tear pattern was. You may then advance to no lifting, pushing, or pulling more than a pound with the arm and no overhead use of your arm. We may then extend it to 5 pounds or 10 pounds or 20 pounds of lifting, pushing, and pulling. At some point, you may reach a threshold where your employer allows you to return to work with those restrictions. On occasion, your employer will not be able to accommodate your restrictions. If that is the case, then unfortunately, you'll have to be out of work. It is not until 6 months postoperatively do I let patients go back to full, unrestricted lifting with the arm, including at work. So therefore, if your employer requires you to have no restrictions on the arm before you go back to work, then unfortunately, you're going to have to be out of work for 6 months after this surgery. Therefore, the first 3 months are really just about motion and stretching. And then the second 3 months of the rehab protocol is really about strengthening. The strengthening takes much longer and requires much more patience. In fact, patients with rotator cuff repairs can continue to see improvements of strength and function for up to a year after the operation. For my workers' comp patients, I do not think that patients reach their maximum medical improvement from a rotator cuff repair until 1 year post-op. Because of that, even though I allow patients to go back to full unrestricted use of the arm at 6 months post-op, I encourage patients to continue with their home exercise program to increase their strength over the course of the following 6 months until 1 year post-op. Not only does continued strengthening exercises increase the level of function of the shoulder, but it also significantly can protect the shoulder from recurrent injury or pain. Whether on the farm, at the construction site, or on the assembly line, machines often do break down. And it is essential to maintain those machines and take them out of service in order for them to be productive in the future. The thought of having to take significant amount of time away from work in order to address your rotator cuff problem can be an overwhelming feeling for patients. But what I tell patients is that they have to look at that period of time as an insurance policy that they will be able to continue to use their shoulder well into their future. Without addressing their rotator cuff tear, those tears can continue to progressively get worse, leading to increased pain and disability, and ultimately to an inability to be able to fix the tendon at all. Therefore, it is necessary for patients to take time out from their job in order to maintain their own bodies. I hope this video has helped you to better understand that process. I hope you've enjoyed this video. Have a good day.